So we have started a program where we've been training health administrators. We already, in the last year, we have trained 25 persons to do health administration. And we picked them from the different hospitals to be able to do that. And we're doing another batch. So hopefully with these types of training and so forth, we'll start seeing a different approach to how we're managing health in the country. Another very neglected area has been in the area of maintaining equipment. So we invest millions of dollars in buying equipment, but we don't have the technical people to be able to maintain equipment. So we have right now about 40 people who we are training to at least have a certificate in biomedical engineering. And hopefully we can grow from that pool individuals who can become biomedical engineers and so forth.
Those were the remarkable words of the Minister of Health, Honorable Dr. Frank Anthony, who attended the consultative meeting held on November 7th for the presentation of findings of Guyana's investment case for the prevention and control of non-communicable diseases. This meeting was a collaborative effort between the Ministry of Health, the Pan American Health Organization, World Health Organizations, and the United Nations Development Program. The meeting was geared at outlining and discussing the subsequent steps, including revisions to the investment cost report and action to support implementation of the recommendation. On November 8th, at his Brickdam headquarters, Dr. Anthony received a courtesy call visit from Mount Sinai Health System. The meeting was intended to review and discuss the implementation and expansion of the comprehensive school health screening for children in nursery schools. On Tuesday, November 14th, the Diabetes Comprehensive Center at Lusignan hosted its first community health fair. This health fair, a collaboration with the Regional Democratic Council of Region 4, was held in observance of World Diabetes Day. The Minister of Health, Honorable Dr. Frank Anthony, who attended the opening ceremony, urged individuals to adopt healthy, life-changing behaviors and emphasized the importance of regular checkups, not just when unwell. He highlighted that this proactive approach can alter the dynamics of chronic diseases. In closing, the Health Minister revealed that the Diabetes Comprehensive Center would soon launch a smartphone app. This app aims to assist healthcare providers in monitoring and caring for diabetic patients, enabling constant monitoring and potentially influencing positive changes in patient outcomes.
Now, one of the things that we'll be doing at this clinic very soon is that we will introduce an app. You know, on the smartphone, they got a thing called apps. So we want to introduce an app. And that app is going to help us to monitor people, what they eat, how much they eat, the frequency with which they eat, and a whole set of other parameters. And we want to do that to see whether this is going to make a difference. So we want to use technology to help us to care for patients. Because when you come to us, maybe you spend an hour with us here, and that's 1 hour every month. But to care for a diabetic person, you need to have constant care. And through the app, we are hoping that we'll be able to have that constant way of monitoring. And I think that would help us to change the numbers that we are currently seeing.
Meanwhile, Region 4 Regional Health Officer Dr. Gavinash Prasad advocated for patients to maintain a healthy diet and engage in regular exercise to positively impact their conditions. This has brought us to the end of this week's review. But before we go, we want to encourage you to get educated on diabetes and its risk factors. If you are at risk, get screened at your nearest health center. If not, you can come down to GAIExpo and get your random blood sugar testing done. We will be there for 4 nights and we will be bringing so many services to you. So until then, take care.